And remember one thing, try to come in class in time. I will not give permission after 5 minutes. So be on time, please. Now, another discussion is discussion is use of anesthetics. What is the requirement of this anesthetics, and basically what are the different indications for anesthesia? Why we require anesthesia, and we consider anesthetic protocol in case of animals. कामरान, श्याम किशोर, श्यामा, आप लोग ऑन करिए, नहीं तो मैं आपको हटा दूंगा क्लास से. वीडियो ऑन करिए अपना. Then first is restraining during different minor surgical intervention, like diagnostic imaging. Many cases we used to have this diagnostic imaging like ultrasonography, radiography. There is no need of using this anesthetics because already I have discussed that every anesthetics is having some side effects. Not a single anesthetics is without any side effect. Always some anesthetics, always all anesthetics have some side effects. Some has less side effects, some is more side effects, some is having more side effects. So try to avoid anesthesia if it is not required. So basically, in case of diagnostic imaging, ultrasonography and radiography, we require this anesthesia for proper staining. Suppose you are going to have a radiography of hip region of a dog, and that dog is having severe pain. If you are going to manipulate hip, even slight manipulation of hip leads to severe pain. So, but radiography is important because without radiography it is not possible to see exact this acetabulum and head of the femur or the osteophytes formation and other things. So in this particular case you need this anesthetic administration. So for this many anesthetic administration is there, I will discuss later on, but in this case we used to have this diagnostic use of anesthetics. Another one is like cleaning, grooming and dental prophylaxis. In most of the dental cases in human beings, most of the surgical intervention, even tooth extraction and dental scaling, small manipulation in dental. Suppose you are interested for tartar remover in case of dog, it is, you cannot go without this without use of anesthesia. Faiz Akram, please keep your video on. नवीन कुमार, सावन कुमार, मैं डिलीट कर दूंगा सबको, हटा दूंगा सबको अभी क्लास से. So in case of human beings, most of the dental surgical affections can be corrected by simple using local anesthetics, by simple nerve block, even RCT, all the things. But in case of animals, it is not possible to do any type of dental manipulation without using anesthesia. So second use of anesthetic is cleaning, grooming and dental prophylaxis. Third one is biopsy, radiation therapy, bandaging, splinting and cast application. Many times in case of fracture cases, yeah, some wound is there. So most of the times we used to have this application is splinting and cast application without any anesthetic manipulation. But if pain is there, animal is not going to cooperate you, then definitely use of anesthesia is required. So these bandaging, radiation therapy and collection of biopsy samples from liver, if you are interested for collection of biopsy sample, then it is also required anesthetics. Then most important in case of wild animals, capture of exotic and wild animals, only option is to have this use of anesthesia. And for this alpha-2 agonist, medetomidine, detomidine and this ketamine is generally used. Sometimes for transportation also use of anesthesia is required. Otherwise, suppose you are interested for transporting one animal from Mysore to Patna Zoo, if you are interested, then anesthesia, mild sedative anesthetic agents is required, because during journey animal will struggle and it will cause injury to the animals and sometimes it may become fatal. So to avoid this type of injury and casualty, we used to have this anesthesia, use of this anesthesia. Then some minor manipulation is there, like catheterization, wound care, and obstetrics. For these also, either for obstetrics, if you are interested for going to this gynecological cases, obstetrics, then definitely if local anesthesia, regional anesthesia like epidural anesthesia is also required. If suppose sometimes in case of catheterization, suppose you are interested for collecting urine from bladder for examination, suppose you are interested for CBS examination, antibiotic sensitivity test, then this collection of urine is required. And this many times, this in case of especially in female, if you are going to collect urine, then sedation is required, otherwise animal is not going to cooperate you. Sonali Raj, please keep your video on. From next class onward, I am not going to say you that please keep your video on. I will delete you. So try to remember, keep in mind. Then anesthesia is basically required for this surgical procedure. Every surgical cases require this anesthetic drug. Next one is control of convulsion, epileptic seizure. What happens in case of animal if animal is having this convulsion, then drug of choice for this convulsion is phenobarbital, Gardinal, which is most commonly used in human beings. Phenytoin, aptoin is a drug, but in case of animal, in case of dog, diazepam is a drug of choice to control this. This convulsion. So many drugs are there, anesthetic drugs is there to require this. Even sometimes propofol and thiobarbiturates is also required to control this convulsion. What happens if you are going to give these drugs? Suppose barbiturates or diazepam you are going to give, then the basic function of this drug is to increase the threshold of epileptic seizure. And by using these type of drugs, we can control this convulsion. Next one is euthanasia. You know, this is mercy killing. Jawahar Kumar. Remove. I am not going to tell you. Remove kar diya. Whosoever is not keeping your video on, I am going to remove this person. Now, next is type of anesthesia. These are the different type of anesthesia. The slide showing star mark is the most commonly used in case of veterinary patients. Like epidural anesthesia. Epidural may be anterior and posterior epidural. Infiltration anesthesia, most commonly used for mucous membrane desensitization, like vaginal mucous membrane. Then next one is inhalation. Inhalation anesthesia is also we used to have this inhalation anesthetic techniques even in our clinics also. Intramuscular administration, xylazine and ketamine is used by this route. Then intravenous, this is most commonly used route of administration of anesthesia. Then topical and transdermal. Transdermal is most commonly used. Fentanyl patch is used for the analgesia, for long-term analgesia. Subcutaneous administration of these fentanyl patch leads to analgesia for longer duration. So these are some common routes of administration of drugs which we used to have. Now, patient evaluation and preparation, general consideration. If animal will come to you, then first of all, you have to evaluate history. History, what is the history of past drug administration? Previous में क्या था ये? How animal was behaving? क्या अब हो रहा है? Physical condition, whether animal is fatty, or animal is lean and thin. This is also important to evaluate consider your anesthetic protocol. History, physical examination, laboratory test. LFT and KFT is very important for CBC. Even whole blood parameter is required for this administration of, suppose an animal is having very less hemoglobin, if animal is having some infection, then you have to rule out all the things. Then only you decide whether this animal is able to tolerate whatever side effect of anesthetic combination is there. So complete laboratory test is required. Patient airway must be maintained in every patient. So always remember, when any animal is showing respiratory distress or anything, so first you treat that particular case for that particular disease. Otherwise, what will happen? Suppose an animal is already having dyspnea, and you are going to give thioparbiturates and anesthetic, which is having deleterious effect on the cardiopulmonary system, then it may be fatal. So evaluate all the things very curiosity. Curious होके आपको पहले वो करना पड़ेगा. Otherwise, what will happen? Every examination should be properly done. सब कुछ आपको लेके करना पड़ेगा. Then only you will be able to monitor anesthesia efficiently. Then patient evaluation. Already you know species, breed, age, sex. Age, sex, breed के लिए भी हम different anesthetic combination लेते हैं. Body weight. Body weight is also important because every anesthetic drug is administered on the basis of body weight. Is even in drug also, if suppose you are going to administer a drug, antibiotic, then body weight is also important. Then severity of illness, then concurrent symptoms or diseases like diarrhea, vomiting, hemorrhage, seizure, heart failure, cough, exercise intolerance, renal failure. Suppose one animal is having seizure and you are going to give ketamine, then what will happen? Ketamine is a dissociative anesthetics. If you are going to give this ketamine in case of animal having history of seizures, then at the time of surgery, what you will see? Recurrent seizure you will notice, because the function of ketamine decreases the threshold of seizures, and if you are going to administer ketamine, recurrent seizure you will notice. So take history that if you are going to use ketamine and xylazine, then take history that whether this animal is having history of seizure or not. Then recent feeding and recent drug administration, this is also important. Anesthetic history and reactions of that particular, if an animal is having any reactions previously, that animal has shown that this animal is having reaction to this particular drug, collect that type of history also. Then current physical examination. Body condition, pregnancy, hydration, temperature. Suppose animal is having higher temperature, pyrexia, fever, then first you treat the patient for temperature to bring temperature to a normal side. Otherwise, it will lead to complications. And cardiovascular system examination, heart rate, rhythm, arterial blood pressure, basically mean arterial blood pressure, central venous pressure, arterial blood pressure, mean arterial blood pressure, diastolic and systolic blood pressure. Capillary refilling time is very important. You just note down what is the position of this capillary refilling time. Then auscultation, cardiac murmur. If animal is having arrhythmia and you are going to administer any drug which is having deleterious effect on the cardiac system, then try to evaluate these things also. Pulmonary, this respiration rate, tidal volumes, depth and effort, whether animal is having restrictive inspiration or restrictive expiration. This is also very important. So cyanosis, upper way obstruction, and this can be judged by percussion of lungs area. आप lungs का percussion करके आप examine कर लीजिए whether animal is having. Then hepatic, LFT already I have liver function test, kidney function test. Then any history of diarrhea, vomition, auscultation of intestinal sound, rectal palpation. Nervous system, where animal is having aggression, depression, seizure, any history of fainting or coma. So try to collect all these history also before considering any anesthetic combination. Metabolic and endocrine system and analysis, this is temperature, already I have discussed. Hypothyroidism, all blood, this can be analyzed by complete blood analysis. Integuments, whether animal is hydrated or not, whether animal is having any neoplasia, subcutaneous emphysema, which is most commonly seen in case of fracture rib, that is known as flail chest. History of parasite, that is the ectoparasite and internal parasite. Anemia, hair loss, burns, and any fluid and electrolyte loss. Any history of trauma. So all these things, hyperkalemia, hypokalemia, you have to complete pre-surgical laboratory workup so that you can monitor a good anesthesia. So these are all about today. Poonam Kumari and Saket Satyam. दीपशिखा,
प्रेजेंट सर।
दीपशिखा अटेंडेंस लीजिए, वही अटेंडेंस लेके मुझे सेंड करिए. एनी क्वेश्चंस प्लीज आस्क. Already I have sent notes up to this class to your WhatsApp group. Please get it print if you are interested. Everything is written there and try to go through that note thoroughly.